I'm Arden Crystal, President and CEO of Southlake Regional Health Centre. As we head into a new fiscal year, I'd like to take an opportunity to look back at the successes and challenges that we've seen in 2018-2019. Over the past year, we've continued to experience challenges with capacity. Our region is growing and aging. In fact, our region will grow by 30% over the next 20 years, and the population over 65 will double. In keeping with our strategic plan commitment to meeting the needs of our growing community, we've been proactive and have addressed these capacity challenges in innovative ways. We know that other hospitals are experiencing similar challenges, and it's our hope that how we address these challenges will also improve the broader healthcare system across the province. Perhaps the largest change provincially over the last year has been the government's announcement of the new Ontario Health Team model in February of this year. Southlake is supportive of this system restructuring and is already pursuing closer relationships with our community partners in order to address capacity challenge and provide more connected care for our communities. With the launch of Southlake at Home, there is greater coordination and communication between patients, their families, and the organizations that provide their care after they've been discharged. Simply put, these improved transitions are empowering patients to get home faster, leading to lower readmission rates and allowing patients to stay healthy at home. For our patients, it's an opportunity to live their best life in their own homes, and the feedback has been terrific. Following the success of our restorative care unit at the Finch site, we've opened another site at Church Street with an additional 30 beds for patients who need transitional care. This will give patients the care they need in a more appropriate setting and help reduce hallway health care. We now have 60 off-site Southlake beds to help patients get the rehab they need to get home or to their next phase of care. At our main campus, we've also added a significant number of new beds this year in our medical and mental health areas and an additional ICU bed. Through all these developments, we've been very lucky to have our patient and family advisory councils by our side. These former patients and family members give us feedback and insights into how we can drive positive change, and they also lead some of those changes in our programs, changes that really improve the patient experience. Our goal is to embed patient and family advisors in every department and unit across the organization and increase the opportunity for meaningful engagement. The following stories highlight the successes Southlake has experienced in the areas of patient care, clinical excellence, and innovation.
Innovators came up with a procedure called the hip resurfacing. We reshaped the femoral head and put a cap. And what that allows is it feels like a more natural hip. It allows patients to be more active, and then it saves bone, allowing revision surgery to be easier. When you look at hip and knee replacement, they're two of the top 3 operations in terms of improving people's quality of life.
All within 6 months of the surgery, which took place in February, I was back to my normal lifestyle. I was walking, I was playing golf that summer, I was coaching baseball that summer, and I was playing hockey as early as October that same year again, within just over half a year of the surgery. And the only regret is that I didn't do it a couple years sooner.
I think it sets Southlake apart in terms of an institution and a hospital that is delivering high quality, modern, state-of-the-art surgical treatment options. And the team that we have at Southlake is top notch.
I've recently had some pretty outstanding experience with Southlake at Home. I recently discharged a patient who I thought would not be able to be discharged from hospital and may require long-term care or an assisted living facility upon discharge. Previously, when I would send somebody home, I would actually have very little communication with what happened once somebody was discharged. And what I found with Southlake at Home is in coordinating this patient's discharge home, we were able to bring Southlake at Home into the hospital, have a case conference including both ours and the interprofessional team in the community to ensure that the transition between hospital and home was safe, clear, and there were no gaps. When the care team from Southlake at Home started to recognize that things were going awry at home, they immediately contacted their primary care physician as well as myself. We were able to arrange a conference with the entire care team via telephone and achieved the desired result. And to this day, the patient remains at home and has not had to come back into a hospital. So that was definitely a success.
So the CardioMEMS device, it's a tiny sensor that we implant using minimally invasive techniques directly into the pulmonary artery. So what this sensor actually allows us to do is pick up symptoms before they're actually detectable. We are equipping patients with a tool to allow them to self-manage their own heart failure with confidence. They're going to rely on something that they can look at that will alert them to when they're starting to get into trouble. Southlake is actually only one of 4 Canadian centers implanting these sensors. And I think it speaks to Southlake's culture of innovation and willingness to take on new technologies that can better service our patients. For the healthcare system, what this basically means is we're able to keep our finger on the pulse of our patient's status without them needing to be directly in front of us. We service patients in the heart failure program from all over Ontario, as far north as Muskoka and even beyond. And this really means less travel, less in-person visits, with the same ability to care for them with the same quality. And for patients that live really far away, we're getting real-time, day-to-day assessments of their status without even needing to see them in person. So the procedure is minimally invasive. There's no cutting involved. The sensor is brought along a line that we just deploy and suspend directly into the artery, and that's it. Probably start to finish, it takes about 1 hour. After the procedure is completed, the patient goes home the same day. We usually recommend some rest and recovery the next day at home and often return to work the following day. Having this technology really allows us to be by our patient's side, even when they live far away.
Healthcare in Ontario is changing rapidly, and Southlake is ready with our new strategic plan, new partnerships, and new ideas. The next 5 years are shaping up to be an exciting time, and at Southlake, we will be by your side through it all.